Now, hygienists are only able to clean a couple of millimeters of depth in the pocket when they're giving you your cleanings. Gum disease is when bacteria from the mouth cause problems in that pocket. You see, we all have happy, healthy bacteria in our mouth, and you must have these happy, healthy bacteria to help you digest food, help keep out the bad bacteria and viruses and fungal. They're excellent. Your whole body's full of them. You can't live without it. If these happy, healthy bacteria form groups, and we call them colonies, then they're able to attach themselves to the teeth. Once they attach themselves to the teeth, they invite over their friends. Those friends are the bad bacteria that can go underneath the gums into that pocket. Once they set up shop, there's an inflammatory response. Basically what happens is you can say the bacteria get hungry and go to the bottom of the pocket, which is your jawbone, and eat it up. Let's say here's the top of the gums and your top of the bone in health is over here. So you have a nice shallow couple millimeter pocket that the hygienists can clean. The depth of the pocket increased. Now, even when you get cleanings, there's still bacteria living over here we cannot reach, and they will continuously have a party on the expense of the bone. The gums, the gingiva, in health is coral pink. If they're not pink all around, especially between your teeth, there's a problem. Another great thing that gives away gum disease is simply brushing and flossing. Many people tell me, oh, I don't floss, it makes me bleed. It's the other way around. You're bleeding because you have the gum disease. What you have to do is floss to get rid of the gum disease, or at least reduce the bacteria so that you won't bleed. You want to know if you have gum disease? Fairly simple. Pick up a toothbrush, pick up a floss, and use it. If you're bleeding, you have a problem. Go to your dentist and have them evaluate you. All that's true if you have blood that's flowing. Now you're thinking, I'm human, I have blood that's flowing, and that's accurate. However, someone who smokes, the smoking is a vasoconstrictor, so it's closing your blood cells, the blood vessels. If you don't have those blood vessels, then you're brushing and flossing. You really have disease everywhere, but unfortunately we can't see it. The tooth is hugged by the gums, and you have a layer of gums with the outer layer over there underneath the pocket. If bacteria get there and cause an inflammatory response, it'll make holes in that pocket. Perhaps microscopic holes, but they're still holes that will allow the blood to come out, and that's what we see bleeding when you're brushing and flossing. It's not because you're brushing and flossing too hard, it's because you have no barrier. Your barrier was destroyed. Now, the same way the blood flows out, the bacteria from your mouth, which is the dirtiest part of your body, can flow in. Now, these bacteria get into your body and they circulate within the blood vessels, and get wherever they want to go. Let's take the heart, for example. If someone has a clogged artery in the heart and they have the surgery, they take out the clots, they put in the microscope, you'll see a bacteria called P. gingivalis. That bacteria is one of the big causes of periodontal disease. It's only found in the mouth in disease. How did it get to the heart? Because it goes through the pocket. Because this bacteria, P. gingivalis, will get everywhere. And that's one of the big ones. It causes inflammation. So any inflammatory disease in your body will have problems. People with diabetes, 5 big complications of diabetes. Well, they added a 6th one, periodontal disease, because it's a bacterial infection. And when you're a diabetic, it's a big problem because you can't fight bacteria, you can't fight infection. So if you're a diabetic, you have to be careful because you will get increased chances of getting periodontal disease. And if you have periodontal disease, it can affect your ability to fight and keep your hemoglobin A1C and your sugar under control. And it potentially can be going both ways. And throughout your systemic body, any inflammatory disease that you have, you need to be very, very careful for.